Hello, this is Ty Newell and COVID status report number 15, guidelines for reopening. And this report is as of May 25th, 2020. We're going to focus today on guidelines for safely reopening. And rather than being fuzzy, shoot from the hip, hope this might work, confusion as we're seeing typically from various levels of government. These are going to be very specific, backed by research that shows why these are important guidelines to follow, and they're practical. They're simple to implement. And the gateway, the key to understanding if the indoor air quality is good in a place you may be entering is carbon dioxide. And I show two sensors here. This red one, which if you carry that into a place and show that, and you can see right now in my house, it says it's 582 parts per million, or this white one, which just a different brand, a little bit more expensive, but showing 584, which is remarkably close. Typically, if they're within about 30 parts per million, that's a very good agreement for meters of this level. And the one thing I want you to remember from this talk is that when carbon dioxide indoors exceeds 800 parts per million, that's not good. Standard practice, and what you will hear from HVAC experts, is that 1,000 to 1,200 parts per million is standard practice. It's standard practice. It is not good practice. And we will explain why. Consider buying one of these meters. On Amazon, you can find them for 100, 200, and as expensive as you want to get. This red one's about 250 bucks on Amazon. The white one is a bit better quality, about 500, 600 bucks, and I've had that one for about 10 years, and it's a good quality one. Consider sharing the cost with some friends so that you might map out the air quality in different businesses that you visit, restaurants, schoolrooms, other public spaces. Take it on the airplane like I did. So as an airline CEO is telling you how they have 20 air changes per hour and how that's an immense amount of air going through HEPA filters and yada, 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 it ain't true. This is a flight from Philadelphia to Burlington about 2 years ago. 1,550 parts per million meant that I was getting crap for fresh air in that aircraft, and I caught the flu. Quick refresher. Next week, we'll spend more time going back to how reopening is impacting the spread of contagion. But when I first started these reports on March 30th, the US was looking horrendous relative to other countries experiencing infection spread from COVID-19, but not remarkably greater than, say, Italy and Spain and Iran and South Korea, which had undergone a month earlier, more than a month earlier, in the middle of February, and an early warning sign that we need to get going. That we had plenty of warning, but instead we lagged. We started outpacing other countries instead of, as we see here with Spain and then Germany and France as they kicked in along with the United Kingdom to turn the corner. And about a month ago, when I presented results showing how social distancing metrics correlate to the spread of COVID-19, and use those metrics to say, if we had gone into social distancing 1 week and 2 weeks earlier, there would have been a remarkably lower, by a factor of 10, cases of COVID-19 in the US, as well as fatalities. Instead of today's 10 times what we had on March 30th, we would have been about 200 to 300 infections and about 10,000 fatalities, in similar agreement to what the Columbia University study has found. So the bright side, if there is one, so trying to keep on a positive note, you can see the US is starting to have a little curvature. It would have been nice to start getting serious back when Germany, when Spain and Italy were, and to have followed the same type of path that they followed, but we didn't. We are starting to bend the curve slightly, painfully slowly. But on the bright side, I'll upgrade our response from pathetic to pitiful. And joining us now in the top three spots are other tough guy bullyocracies with US, Brazil, and Russia in first, second, and third place. Reopening guidelines. Three very simple ones. First, increase fresh air. Open windows, open dampers, increase fan speeds. In whatever manner fresh air gets into your home, into your business, into your schoolroom, get more fresh air in. Increasing the amount of fresh air decreases the concentration of contagion, and the amount of contagion you inhale is what determines your probability of getting sick. And contagion concentration directly correlates with the number of people that are infected and shedding virus, that are breathing in an indoor space. And that also correlates directly with carbon dioxide. That's why carbon dioxide is such an important metric. It's a surrogate, it's a tracer for how much contagion may be in the air that you're breathing that came out of someone else's lungs. And what this turns into in a practical sense is about 40 cubic feet per minute of fresh air per person in a building. And this is roughly double what current ventilation standards are. So I would expect in most places you might check the air quality that you're going to measure maybe 1,000 to 1,200 parts per million, indicating that it probably is meeting standard guidelines for ventilation, but also indicating that those guidelines, which are based on odor and trying to keep the number of people complaining about smelly air rather than being based on health. A health-based ventilation standard would specify a minimum of 40 cubic feet per minute of fresh air. And the direct way to know that you're getting at least that much fresh air is carbon dioxide measurement. It's the simplest, most effective way to do it. And the benefit on top of that, your brain will function better, cognition from decision making to creativity to focus to other cognitive functions. You will be operating much more productively, and you will sleep better too, which also makes you more productive. Second, make sure there's also an amount of air recirculated through a filter, whether it has a central air conditioning furnace system, and in that case, replace the filter, which most likely you'll find a MERV 8, which does not filter out contagion effectively. Replace it with at least a MERV 13 or 16 filter. And if you don't have that type of system that can have a higher filtration level added to it, get a standalone filter. It's very important to also filter contagion. And with a MERV 13 to 16, even though a virus particle itself is a very, very tiny entity, that these are typically embedded in what are called droplet nuclei, which are droplets that came out of you from speaking, breathing, coughing, sneezing that have evaporated down into a tiny particle, but one that can be effectively filtered. And then the third step, consider adding UVGI, ultraviolet germicidal irradiation, to the recirculation airstream. And if you add enough ultraviolet light power about 0.02 watts of ultraviolet per cubic foot per minute of airflow. This will give you about an 85% single pass kill efficiency. That is anything that gets through the filter, whether bacteria, virus, mold spores, and other things that you also would like to minimize in your air. That for 200 cubic feet per minute, sufficient for 5 people in an indoor environment, you need about 4 watts of ultraviolet radiation power inside of a duct. And this is about a 16 watt ultraviolet bulb, 16 watts of electric power. The next set of guidelines, more for public gathering places rather than your home, but it depends on your needs and your sensitivities. Studies have shown that washing and spraying disinfectants, while important, may not be as effective as we think in removing contagious matter from desktops and tabletops and other surfaces, floors. And an additional layer of protection is to add ultraviolet germicidal irradiation. But these are lamps that might be, say, mounted on the ceiling, say in a restaurant or in a place with a lot of public entering and exiting. And during unoccupied periods of time, that these lights will turn on, so typically in the middle of the night, for a certain period of time to also deactivate and to destroy virus, bacterial, and other contagious matter. Medical facilities regularly use these, and it is, for example, one study in a hospital in Vancouver studying isolation rooms of about 700 patients found that where washing with disinfectants lowered the amount of contagious matter from about 35% of the surfaces to about 30%. So not a very large drop at all. But then adding ultraviolet sanitation throughout the room dropped that level of surfaces, contagious surfaces, what are called fomites, down to about 2 to 3%. So knocking it down by a factor of 10 from washing and disinfecting. Encourage staff, customers, visitors to wear face masks. Anyone wearing a face mask is for protecting others, as you've heard so many times now. And a face mask may drop out, say 50% of the droplet spray coming from your mouth as you talk, breathe, sneeze, and cough. And that's significant reduction of contagion in the air around you, contagion that's going to land on different surfaces, contagion that might directly spray at someone and infect them. And for those cantankerous people who refuse to wear a mask, the unmaskers, stay more than 6 feet away. Think of somebody smoking a cigar or a cigarette, except you're not going to smell a virus, and stay as far away from them as you would if there's smoke wafting by your nose. This plot shows this direct relationship of the probability of infection relative to carbon dioxide concentration. And this is an example plot. I use an airborne infectious model called Wells-Riley to make this plot. But the key thing is that in this example, for say an indoor environment with 1 infected person and 3 uninfected, there's a direct relationship between the carbon dioxide level, the time that you're in that space, and your probability of becoming infected. You can see that both time as well as carbon dioxide are important. And my recommendation is to keep your time limited to as short a time as possible in a public space, especially now where the contagion is still growing so rapidly in the US, and to keep the carbon dioxide concentration at 800 parts per million or less. Bring in more fresh air. So this is the direct linkage, but replotting this in a different manner relative to standard ventilation practice, which is shown by these three upper curves for residences. This ASHRAE 62.2 2010, although it's an old ventilation standard, it is one that's still currently in use. For example, EPA's Indoor Air Plus certification, something that people getting green building certificates are using. It's the worst of the bunch. It allows you to use this 10-year-old standard. ASHRAE 62.2 2019, the current standard, is a little better, but if you're going to be spending 8 hours in a space occupied with one infected person, and there's 3 of you who are not, you've got more than a 95% chance of becoming infected if you're spending 8 hours in that space, or basically having about 1,000 to 1,200 parts per million of carbon dioxide concentration. This 20 CFM per person is somewhat of a rule of thumb used in commercial and public buildings, resulting in about 1,000 parts per million of carbon dioxide concentration. And it isn't much better than the current residential standards. The pH standard is the Passive House standard of 0.3 air changes per hour. And for this example of a 1,000 square foot, like multifamily apartment or manufactured or mobile home with 4 occupants in it, that it's not any better. It's just as poor as current ventilation standards. Increasing to 40 CFM per person, just looking at the 8-hour time together line, you can see that we dropped from 95% down to about 75%. If you recirculate about 90 to 100 CFM of indoor air through a MERV 13 to MERV 16 filter, you will knock your probability down to about 60%, which is a significant amount relative to 95, or almost a certainty that you're going to get sick if someone in that room has the infection. And if you add the ultraviolet germicidal radiation to that recirculation air, you can knock that down to about 50%, which, at least flipping a coin, is much better than a 95% almost certain that you're going to get infected. So that's guidelines 1, 2, and 3. 800 parts per million or less as far as carbon dioxide, which is an airflow, fresh airflow of 40 cubic feet per minute per person. Recirculate and filter with MERV 13, MERV 16 level filtration. And then finally, consider ultraviolet radiation, that these lamps are not expensive and they don't take a lot of power to operate for an 85% kill efficiency at typical residential occupancies. Guidelines 4, 5, and 6. As far as wearing a mask, this is that same plot, but now if we assume that a mask, and this is not an N95, say, bidirectional protection mask, but just the simple cloth masks that so many of us have been wearing during this time of shortages of these better protection masks that we need so much for our frontline and medical personnel. But with the masks that simply knock particulates down from your mouth as you're talking, as you're sneezing and coughing, that if that knocked the contagion down by about 50%, what then gets into the air and is spread around, we see that there is a reduction of contagion density in the air, and that reduces the amount of contagion layering on surfaces that could infect us, as well as knocking down that direct spray that might impact us. And in terms of the guidelines of doubling the airflow rate, recirculating through a high efficiency filter, and adding ultraviolet germicidal irradiation, we could knock down in, say, a more public space to a level where we're less than 50% and perhaps as low as 30% likely to catch the contagion if there's an infected person in that room. So for businesses, schools, and other places, I recommend masks are important when you're in these places where you're less certain of who's infected and who's not, and getting the fresh air level up to this standard for further reduction of infection probability. And on top of that, consider UV surface sanitation. Consider also that when you're facing an unmasker, someone who's demanding their right to infect you and others, stay more than 6 feet away from them. They're most likely going to argue their right. This day and age of rage, it's not worth it. Keep away from them. Let businesses know if they're going to be serving unmaskers that you would like to be seated somewhere else or you're taking your business elsewhere. It doesn't take many of us to do that. So to conclude, many areas are backsliding. We're going to revisit that next week. There is some good news, but more bad news than good news, unfortunately. Make business owners aware that they're going to lose your business if they favor unmaskers or are unwilling to accommodate you where you would like to stay safe and protected. And in restaurants, this should be very doable because it wasn't that long ago when we had non-smoking and smoking sections. Put the unmaskers in what used to be the smoking section, hopefully a closed off, poorly ventilated room, and that you would be seated in the better ventilated, separately ventilated room. And again, if a business loses 1%, that comes off the profit line. Businesses first have to make their costs and then they start adding profit. So when you pull 1% of their business away, that's off the profit. And of course, that business goes to their competitors. And so it's doubly impacting. So, but on a positive note, if you're a business owner, these guidelines are meant to help protect you and your employees and your customers. And if you are serious about opening safely, follow these guidelines and then let people know here's what you're doing and here's why. Not that you're using the shoot from the hip uh, type of guidelines that are currently um, coming out of various government agencies. So important things: protect yourself, stay more than 6 feet away from unmaskers, say 20, 30 or more. Avoid indoor spaces with carbon dioxide greater than 800 parts per million. Consider getting your own meter and just checking out the places that you're visiting to see how safe and how long you might stay there. Use the mask, stay distance. Thank you, essential workers and medical staff.